Hello, my name is Dr. Funda Goldman. I'm a licensed naturopathic physician with a private practice in Stratford, Connecticut. And today I wanted to discuss Marma Therapy and specifically the energy points, Ayurvedic energy points on the front of the neck and how they can be used therapeutically. Before we get too far along, please note information presented here is for educational purposes only and should not be considered medical advice. For any symptoms that are severe or worsening, please contact a qualified healthcare professional. And remember, it's always important to determine the root cause of any disease and to develop a comprehensive treatment plan, of which a Marma therapy can be a part. So just a bit about Marma therapy, if you haven't heard about it before, it's a therapy that's over 5,000 years old. It comes from Ayurveda or traditional Indian medicine. It's considered an energy therapy, and so there are 107 different Marma points or energy points on the body. And if you're interested in more history on Marma, you might take a look at my first video on the Marma points of the hand, because I have a little bit more there. But otherwise, let's get started with the points. So the first one is called Kantha. That's Sanskrit, and the translation is throat. So the location of this point is on the midline of the front of the neck, and it's depression above the hyoid bone. So if you take your finger at the top of the neck midline and you start sort of dragging it down, right above what would be considered the Adam's apple is about where you want to be. So the energies involved with this point, and again, these energies may not make a lot of sense to you unless you're a deep student of Ayurveda, but the general energies are the Pranavayu, the Uddiyana-vayu, Sadhaka Pitta, Bodhika Kapha, and Avalambaka Kapha. And just so you have a sense of it, Avalambaka Kapha, for example, is the sort of watery energy that's in the lungs that's important for respiration and transfer of oxygen and carbon dioxide. So again, if you're a deep student of Ayurveda, that'll make sense, and if not, you'll still get plenty out of this, hopefully. So anyway, the indications for this point, and they're actually similar to the next point I'm going to talk about, Kantha Nadi, but they're actually a little bit weaker with this point, is that all nadis, all Marma points have local effects. So the local effects for this particular point involve the pharynx, larynx, the trachea, and the lungs. It does also affect hormone function, so from the thyroid, parathyroid, and if there's a goiter in the neck. It helps with respiration, so it calms down respiration. It aids in bronchodilation. It can help with asthma, chronic cough, and difficulty breathing. It can also help with speech, so speech disorders, hoarseness, laryngitis, expression, and just general expression of thought, feeling, and emotion through speech. That's how you express yourself, right? So if somebody has issues with that. It can also help with the GI system, the upper GI, so tonsillitis, difficulty swallowing, reflux esophagitis, and hiccups. And it is also used to help increase Agni, which is sort of the digestive fire and fire in the body, which helps to decrease ama or toxins. So it helps on both sides of things. This point can also be helpful with helping to relieve suppressed emotions. And if you're a student of yoga, this is the area of the throat chakra. So it's considered sort of the purity of speech and emotions and using right speech, using your speech, right? We understand the power of speech. And so like hateful speech, for example, can send people, society in negative directions. So having clear, heart-based, thoughtful, pure speech can be aided through this point. So that is Kantha. So if you go straight down the midline, you're going to eventually get to a little notch when you hit the sternum there. This point is called Kantha Nadi, which means channel of the throat. And the location, specific sort of anatomical position, is the center of the suprasternal fossa. So again, if you just run your finger down the midline of the throat and you come to this little notch before you hit the sternum, that's where you want to be. So the energies, general energies at this point are the Pranavayu, the Uddiyana-vayu, the Vyana-vayu, Sadaka Pitta, and Avalambaka Kapha. Indications for this point, as I mentioned, they're similar to the previous point of Kantha, but this point tends to have stronger effects. So again, local effects of the pharynx, larynx, trachea, and lungs, hormone functions such as thyroid, parathyroid, and goiter, helps with respiration. So it's calming, it helps bring bronchodilation, asthma, chronic cough, and difficulty breathing. It can help with speech disorders, hoarseness, and laryngitis. The GI system, so tonsillitis, dysphagia, or difficulty swallowing, reflux esophagitis, and hiccups. This one's a little bit different in that it can actually help with metabolism as well. And as it's a little bit closer to the heart, it does actually have some impact on cardiac function and can help with arrhythmias and palpitations. And this one is also good for suppressed emotions. So second point here, Kantha Nadi. The third point is called Mantha, which translates to churning. The reason why is that this one's located on the sternocleidomastoid muscle. So it's sort of this rope that kind of sort of comes from the ear and down to the sternum. And sometimes when you turn your head, it really pops out. You can see it better. But it's like this rope, and so if you kind of pull on the rope or you flex the rope, then your head will start churning, right? So anyway, the location specifically on the sternocleidomastoid is that it's going to be on the anterior border, so on the sort of more front part of it rather than the posterior border, and it's going to be on the upper 1/3. So if you found Kantha before, which is at the sort of top of the Adam's apple, and you just slide your finger over till you meet the SCM, sternocleidomastoid muscle, that's where you want to be for this point, Mantha. So the energies involved here, Pranavayu, Udanavayu, Vyanavayu, Sadaka Pitta, and Tarpaka Kapha. So the indications here, and they're going to be similar to the next point, which I haven't discussed yet, but that's Shiramantha. But the energies at this point are a little bit weaker than Shiramantha, so keep that in mind. Again, local effects as with all Marma points, so the pharynx, larynx, and it can also help with neck tension and cervical lymph node circulation. Since the sternocleidomastoid muscle is really important for rotating the neck, and there's a cervical lymph node chain right there, a few of them actually, and then it also helps with hormone function, so thyroid, parathyroid, and goiter again. It can also help with speech, especially hoarseness. It can help with GI function, so difficulty swallowing. It also has some effects on the cardiac function, so involving arrhythmias, palpitations, and even regulating blood pressure because of the cardiac plexus that's over there that regulates sort of blood pressure and blood pressure to the brain, and regulates rhythm of the heart. So that plexus is right there. This one also helps with the mind, calming down the mind. It can help with confusion, depression, even fainting and vertigo, because again, we're getting closer to the head. And this, as with the other points, can help with suppressed emotions. So third point here is Mantha. Point number 4 is Shiramantha, or which translates to rope that churns. So again, this is located on the sternocleidomastoid muscle, and this is also on the anterior border of the SCM, but it's 2/3 down. So the previous point Mantha was 1/3 down. This is 2/3 down. So if you find Mantha and you slide down a little bit further, you'll be at Shiramantha and you'll be at the point. So the energies involved here are Pranavayu, Udanavayu, Vyanavayu, Sadaka Pitta, and Rajaka Pitta. The indications, as I mentioned, are similar to the previous point Mantha, but the effects on this point are stronger. So again, local effects, pharynx, larynx, neck pain and tension, range of motion, because again, that sternocleidomastoid muscle is so important for being able to rotate the head, and also cervical lymph node circulation. This one again also helps with hormones, so thyroid, parathyroid, and goiter. It can help with speech, such as hoarseness. It can help with the GI, such as difficulty swallowing. It can also help with cardiac function, arrhythmia, palpitations, regulation of blood pressure, and angina. And it can also help with the mind, especially vertigo. So there you go. Fourth point, Shiramanta. The fifth point is Akshaka, which translate as makes the eyes bright. So you might anticipate that this one's going to be a little bit different than the previous points. But the location of this is going to be superior to the medial border of the clavicle. So it's going to be above the clavicle, towards the midline, but not quite on the midline. And it's going to be between the sternal and clavicle heads of the sternocleidomastoid muscle. So what that means is there's actually going to be like a little depression or pocket between the posterior side of the SCM, as far as you can go down there, and the clavicle. You can see there's like a little triangle pocket there, and that's where you want to be. So the energies of this point are the Pranavayu, Uddanavayu, Vyanavayu, Sadaka Pitta, Alochika Pitta, and Ranjika Pitta. And again, if you're a student of Ayurveda, you're seeing that basically this is all wind energies and fire energies. So this point's a little bit different. And again, as with all Marma points, it has local effects. So it can help with laryngeal congestion as well as cervical lymph node circulation and congestion. It can help with respiration, especially like respiratory distress and hiccups. It helps quite a bit with the GI, so that's where the fiery energy is a little bit more fiery than the other points that I've mentioned on the front of the neck. It helps with the liver and gallbladder and the spleen. But what's kind of funny about these points is that if you contact this point on the right side, it will actually affect the spleen. So the spleen's on the left. And if you contact the point on the left side, it actually helps the liver and gallbladder, which is on the right. So it actually has a sort of crisscross effect. So just so you know. And then both sides, the right and left side at this point, Akshaka, help with nausea and vomiting. This pair of points also helps with cardiac function, palpitations, arrhythmia, and angina. And this one is different from the other points on the front of the neck. It has a specific function for the eyes and can help with vision and clarity of the eyes. And this one is also very helpful for emotions, especially pitta type emotions or fiery type emotions such as anger, irritation, and impatience. So there you go, point number 5, Akshaka. And the final point here, point number 6, is Jatru, which translates as preserver or maintainer. And you'll see, based on the indications, that this really has a lot to do with, one thing is building ojas, which ojas in Ayurveda is considered this sort of like subtle quality that's really almost sort of like nourishing water. It keeps the tissues healthy. It's almost like the sort of fluid that's important for helping a garden stay moist and to grow. So we have a similar sort of fluid in us that's called ojas, and this point can help build that so it can maintain the whole body so it doesn't burn out or dry out like a garden sitting in the sun without enough water. So the location of this point is just below the suprasternal notch. So this point is going to be just below Kantha Nadi. So again, we have 3 points on the midline of the front of the throat. We have Kantha first. If you slide down, we have Kantha Nadi, and then below Kantha Nadi on the sternum is this point Jatru. The energies at this point are the Pranavayu, Uddanavayu, Sadaka Pitta, Tarpaka Kapha, and Avalambaka Kapha. The indications, again, local, throat, lungs, larynx, pharynx, bronchi, and chest lymph nodes. Hormones, again, thyroid, parathyroid, and goiter. They can help with speech, especially communication. There's more subtle aspects of speech, like communication and expression. It can help with respiration, helps to regulate it, asthma, difficulty breathing, infections, and hiccups. It has GI function. It can help with reflux. And again, because it builds this ojas fluid, the sort of maintaining, nurturing, nourishing fluid, it helps with immunity. It can help with spleen function. It can help with fatigue, like in a chronic fatigue syndrome. And it can also help with autoimmune disease. Because again, when the immune system is attacking the body during an autoimmune disease, usually the body gets inflamed and hot and dry. And so building up ojas can help build up immunity, balance it out, and protect from some of the more extreme effects of autoimmune disease. This point, like the first point, increases Agni or digestive fire, and by having good sort of Agni in the body, it helps to burn up toxins or Ama in the body. This one also helps with suppressed emotions, and this one also is a little bit unique in that it helps to stimulate Bhakti. And Bhakti is considered to be heart-based devotion, and you might contrast it with like a jhana type of devotion, which jhana type devotion is somebody who like maybe reads spiritual books or studies spiritual scriptures and things like that. So that's more the path of the mind or devotion of the mind, and bhakti is more devotion of the heart. So there you go, the final 6 point. And we'll just take a couple minutes here just to integrate all these so you can see all the points here together. You have point 1, Kantha. You slide down the neck at the suprasternal notch. That's Kantha Nadi. You slide down a little bit further, you get to Jatru. And you've got a couple points on the SCM, sternocleidomastoid muscle. You have Mantha, which is just if you slide laterally from Kantha, you'll get to Mantha. And if you start, that's about a third of the way down on the SCM. You slide down a little bit further where you get to about 2/3 of the SCM, you'll get to the 4th point, Shiramantha. And then the 5th point, a little bit lateral to all of this, is Akshaka, which is, again, right between the clavicle and the posterior border of the SCM. So just so you have them all together. And then in terms of their effects, so all of them have local effects. We discussed that. Almost all of them, except point number 5, help with hormones. Points 1, 2, 5, and 6 help with respiration. Almost all the points except 5 help with speech. All the points help with GI. Number 2 is helpful for metabolism. Points 2 through 5 are helpful with cardiac function. Point number 5 is unique in that it helps with eyesight and vision. Point 3 and 4 are particularly helpful for the mind. Almost all the points except for point 4 are good for suppressed emotions. Point 1 and 6 are good for building up Agni or cellular tissue fire and burning up toxins. Number 6 is really the best one for immunity, supporting proper immunity. Number 1 is related to the throat chakra, and number 6 is related to bhakti devotion. So there you go, 6 Marma points on the front of the neck. So there you have it. Hopefully we've added another 6 points to your repertoire of Marma points out of the 107 total. I want to thank you for your time, and I wish you all the best. Until the next one, take care.